COVID-19 pandemic that began in March 2020 exposed some weaknesses in the Kenyan healthcare system. Politicians in Kenya are accused of causing divisions amongst the citizens of Kenya during the 2022 campaigns. Over the last 7 years, the use of mobile loans has increased credit access in Kenya by 6 times. According to recent reports, only 23% of Americans get enough exercise. This is Uzalendo Newsreel. I am Lisa Mudhani. We welcome our viewers from Kenya and around the world. We will be with you for the next 30 minutes. Thank you for joining us. This is Uzalendo News. You can join the conversation on our social media pages: Facebook, Uzalendo News, on Twitter at Uzalendo News, and join the hashtag Uzalendo News Live. For many years, health has lacked the political attention it deserves, resulting in negative consequences for investment, strategic thinking, and planning. Kenya's government's health spending is insufficient. It has averaged nearly half of their budget declaration's aim of at least 15% of national budgets. During the previous 2 decades, the African Union heads of state established this in 2001. Uzalendo's Farah Fauzi has more on this story.
Kenya's healthcare system is divided into 3 categories: public, private, and faith-based or non-governmental organizations. About 48% are operated by the Ministry of Health, 41% are private, 8% are faith-based health service, and 3% are run by non-governmental organizations. About 20% of the Kenyans have health insurance, including government health insurance, NHIF. However, the percentage varies by area. In Nairobi, for example, 41% of inhabitants have coverage, yet in marginalized rural regions like Wajir and West Pokot, only 3% will have coverage. The basic problem of Kenya's healthcare system is the mismatch between requirement and accessible treatment, particularly specialty care and manpower from physicians to technicians required to manage it.
Since we had the outbreak of COVID, we had to increase the staffs in our facility, and also considering about isolating patients, because there are some people who are scared about the ICU and all that. We could not take all the patients. The moment they're COVID positive, we rush you to the ICU center. So we had to have an isolation where people had just some mild symptoms and they get tested and they're positive, just for recovering. The beds, the number of beds had to be increased, because actually there was a time the patients were more than the normal patients.
Wenye ninajua ambao walipata ama waliathiriwa na hii ugonjwa, wengi wao serikali ilichukua jukumu kuu ili kuwashughulikia.
Sasa sijaitumia, lakini kuna wakati ilinisaidia, nikaona kwamba ilinisaidia. Kuna wakati gari ilinigonga, ikanigarimikia pesa ambapo singaliweza. Mguu ilikuwa imevunjika tayari, ikanigarimikia. Sasa ndio natembea leo sababu ya NHIF.
Like education, healthcare also needs some importance. It's actually health that's wealth and not pieces of gold.
And now our correspondent Farah Fauzi joins us live. Can you hear me, Farah?
Lisa, I can hear you.
Farah, my first question is, did the country only survive the pandemic because of the loans and grants given to us by other countries and organizations?
Lisa, that's actually a very good question. True, the loans helped the country through this difficult time, but Kenyans also helped each other, and it was more of helping each other and brotherhood that actually made us survive this.
Farah, how helpful was NHIF to citizens who are admitted to hospital in terms of relieving the burden of paying the full amount?
Very helpful. I think if it's not the NHIF, the public, the normal Kenyan will have a lot of problems in terms of the healthcare system. So it provided the healthcare facilities to the public, and I think the common mwananchi is the one who benefited a lot from this.
And lastly, Farah, do you think the government should regulate all hospitals and clinics to prevent them from being profit-based?
Yes, I think we need the government to regulate the healthcare facilities. For example, in Canada, they have regulated the healthcare facilities, and that is why it is very much affordable in that country. The healthcare facilities is very much affordable. So I think if Kenya takes an inspiration from that country, it will be very effective.
Rural hospitals face challenges in remaining viable and delivering high-quality care in their communities. The state of a country's strength is only as good as the state of its people's health. Joining us live is Dr. Murage from Radiant Group of Hospitals. Dr. Murage, my first question is, were private hospitals already at an advantage in terms of finances and funds compared to public hospitals during the COVID-19 pandemic?
Yeah, most of the private hospitals in Kenya are usually well funded with equipments. The only problem is most of Kenyan population cannot afford. So most of the patients couldn't get the treatment in private hospitals, so they end up going to the public hospitals where there is space also, and the services are a bit cheaper.
According to research, the government has allocated fewer funds than recommended by the Abuja Declaration in 2001. Does this end up having negative consequences in terms of manpower and equipment available in public hospitals?
Well, yeah, if there are no funds, there is no manpower. First, even if you're going to have manpower, you're not going to be able to pay them. So at the end of the day, you find you'll find people will start what do you call them? Kugoma. It's called what? Strikes. Yeah, strikes. Sorry. With no proper equipment or enough equipment, so funds are needed anyway in the health sector.
Should the government emulate the private sector by making their hospitals more profitable in order to give them more funds for development?
Anyway, most of the government hospitals, especially maybe from like level 3, they are already profitable organizations, because clients or the patients always pay for services on subsidized prices. So they are not really like they don't go to they don't give things for free anyway, not unless maybe the health centers. But the government is supposed to fund the hospitals more to improve the services, but not the other way around, not to increase the cost of anything in the hospital, because most of the patients would be able to pay.
Thank you so much for joining us, Dr. Murage.
You're welcome.
Kenya's next general elections aren't due for another 4 months in August 2022. However, the battle to be the country's next president was already heating up a year ago. Since 2007, the months leading up to and after elections have been the most violent in Kenya's post-independence history, with thousands of people left dead and hundreds of thousands displaced. Join the conversation and let us know what you think on our social media platforms. Facebook, Uzalendo News, on Twitter at Uzalendo News, and use the hashtag Uzalendo News Live. Gloria Mwangi has more on this story.
In Kenya, the introduction of multi-party democracy in 1992 resulted in the ethnicization of politics, with parties clustering around tribal power brokers and a constantly shifting political landscape. As an inter-ethnic coalitions formed and disbanded. Kenya's electoral scene is still characterized by this. The instrumentalization of the tribal identities and the exploitation of ethnic grievances remain the major foundation of political mobilization in the absence of parties founded on a clear political doctrine, with the prospect of violence and its deployment looming over every election cycle.
Kusema hasula, unajua kama mimi saa ingine naweza kuwa nasema nafanya kazi ya hasula. Hiyo siku kutenganisha wa Kenya, juu sasa alikuwa anafanya kazi ya hasula. Kwa hivyo sasa ndio alisema hasula. Sasa tuseme kama ile kazi mtu anafanya, anaenda kufanya kazi anasema yeye ana haso tu. Naona kwaso ni kama kutafuta, si kutenganisha wa Kenya.
The name hasula venye ilikuja, venye mwenye alileta kama ni watu wa chini, watu wametoka from poor mpaka ground, ndio alileta namna hiyo. Sasa akasema kuna hasula na kuna dynasty. Dynasty tukachukua wale watu wamekuwa kwa uongozi, wamekuwa na pesa, watu matajiri wenye wanakaa Runda, wenye wanakaa nini, hao tukajua ndio dynasty. Sasa hiyo kutenganisha imeweka kama maskini wakuwe kwa hasula, wachague mtu hasula kama wao. Inatenganisha watu sana. Unakuta matajiri tunajua ni dynasty. Unakuta watu mahasula wataki hao matajiri, wataka wapikie kura mahasula wenzao. Imetenganisha, imeweka watu kwa line mbili.
Wakenya sio ati wanatenganishwa saa hii. Wakenya tulitenganishwa kitambo. Wakati uliona ya kwamba kuna vitu zingine ambazo wewe unaweza fanya, zile mwingine hawezi fanya. I think ile kitu ambayo wanataka kuleta sasa ni kama ile wakati wa ukoloni. Kuna wakati wakoloni walikuwa naenda hospitali kama Kenyatta, sisi tukienda zile za chini. Meaning if you don't have resources, enough resources, bado utabaki pale pale. Kuna wakati nimetaja hasula na dynasty. Now they want to show the real thing. Sasa sio vile ilikuwa inatajwa. Sasa saa hii ndio wanataka kuionyesha. Because if there will be a road for a man who have money and a road for people who don't have money, then hata tumeikatanisha tayari.
These political dynamics and conflict tendencies taken together suggest that Kenya will encounter violence in the run-up to, during and after the 2022 elections. Socio-economic disparity, which has historically been mobilized along ethnic lines but is now presented as a problem of interclass conflict, has replaced by the Hustler v. dynasty narrative, is perhaps the single largest conflict generator in Kenya. Because the reality of the class disparity is evident, this story resonates with a large number of Kenyans. The task then is to refashion the narrative as a constructive and peaceful political agenda with the purpose of societal integration, not polarization, in order to avoid the political dynamic from creating violence. Gloria Mwangi for Uzalendo News.
As campaigns are ongoing, Kenyans should remember that when politicians talk about large groups of their fellow Kenyans as enemies, it's time for quite star of alertness. Polarizing people is a good way to win an election and also a good way to wreck a country. Joining us live is Mr. Martin Andati, a political analyst and government expert. My first question is, what is your stance of a campaign tag such as Hustlers versus Dynasty?
That was misplaced. Because they were trying to create a narrative about the rich-poor divide. But even Jesus said the poor will always be with us. So it was a divisive campaign which had been started by DP Ruto. But when President Uhuru Kenyatta said that if Ruto uses that, he will talk about two tribes having power for 61 years. It caught him off guard and he stopped it. So he's not been so much talking about it.
Does such a campaign tag have the same effect as the tribalistic divisions that we are trying to grow out of as a country?
It was not tribal. You know, when you talk about the rich and poor, it's across communities. So it has nothing to do with, you have rich people in all communities, and you also have poor people in all communities. But the only thing is it's divisive. Because who is rich? You know, wealth is relative. Somebody who owns a car in some places is perceived to be rich. But you see, the car could be acquired on loan. Somebody who lives in upmarket areas in Nairobi could be seen to be rich, but they could be just tenants, or they are living on mortgage. So, you know, now it depends on what one says, sees as rich and poor. So it is a divisive campaign, and the poor will not get out of poverty because the rich will become poor. You need just to address the policies so that those issues are addressed. Creating a class divide is not the route to go.
So, Mr. Martin, according to you, do politicians create divisions and incite hatred amongst Kenyans during the campaign
They
season?
try to do sell everything and anything that will give them mileage. So, if you remember, there was a 41 against 1, which was Raila's campaign mantra in 2017, 2013. 2007, he tried it in 2013 and 2017, it didn't work, but he tried it in 2007, and the country almost went to the dogs. So the politicians will come up with anything and everything that they feel is going to give them an edge over the opponents in elections.
Mr. Martin, how can politicians campaign against the oppositions without creating divisions amongst Kenyans?
Right now, I think this campaign is not so much hinged on tribe, because you have the Kikuyus, who are the largest community. They don't have a candidate. You have the Luyas, who are the second largest community. They don't have a candidate, a leading candidate. You have the Kambas, the third largest community. They don't have a candidate. So the election is not going to be fought largely on ethnicity. It will be fought largely, it has actually been fought and is being fought largely on a competition of ideas, which is good for the country. Apart from in Kalenjin land and in Luo land, the rest of the country is going to vote based on policies, issues, and ideology, which is very good for this country. So I think our democracy is growing.
Mr. Martin, what is the possibility of another post-election violence this year?
There will be no post-election violence. That one you can take it to the bank. Uhuru, the sitting president, is not a candidate, although he has taken sides. He has guaranteed us that there will be no violence. 2, after the ICC experience, Ruto and his team will not want to cause trouble, because if they cause trouble, they will just be chaperone to the ICC, so there will be no electoral violence. That one you can be sure. If they lose election, they have other ways. They can go to the Supreme Court, and the Supreme Court has proved that it can nullify a presidential election of a sitting president. So anybody who is aggrieved, you can go to the courts. You saw the other day they ruled the BBI, and the president and Raila lost what they had expected they will get from the BBI. So we have developed faith in the court system. And anybody who feels aggrieved by the results has every right to seek remedy in the courts. So you don't need to take anybody to the streets.
What advice can you give Kenyans on qualities they should look out for in a politician they want to elect as the campaign season continues?
An honest person. Sell policies. Of course, they are very rare. See, look at the track record, see what they are putting out there. But of course, you know, money is still a big factor. Although that is not the sole determinant. You saw a young girl the other day winning in Bomet. She didn't have a single coin to her name. So it tells you, if you are able to reach out to the people properly and message properly and emotionally connect with them, they will be able to vote for you. You saw even in Kericho, former CS Keter, he lost to a guy who is not very well financially endowed. The same too was in Gishu County and many other places, the party primaries. So that tells you you need, if you are able to connect to the people and you understand the issues that affect them and articulate them properly and they trust you, they'll vote for you.
Thank you, Mr. Martin, for joining us. Coming up next, we look at the benefits of mobile learning platforms such as Fuliza and Mshwari and the impact they have on the economy. Stay tuned.
Get fresh, gotta get fresh. Down is a boom boom pow, down is boom boom pow. Smells bayana uchafuzi na zibina empty down it. Protect nguo zangu na nukia niko safi. Lazima niwe fresh na down is boom boom pow. Boom boom pow, down is the boom boom pow. Smells zote na zi boom boom pow. Powerful freshness, down is boom boom pow.
Kenya has seen an increase in mobile-based lending over the last 10 years. According to some estimates, there are 49 mobile lending platforms. Although the sector is mainly unregulated, it does include significant financial institutions. Instant mobile loans are available from banks such as Kenya Commercial Bank, Commercial Bank of Africa, Equity Bank, and Coop Bank. The burgeoning financial technology, fintech industry has enabled these loan options. Share your thoughts with us on Facebook, Uzalendo News, on Twitter at Uzalendo News, and use the hashtag Uzalendo News Live. Linduta with more details.
Kenyans who don't have official bank accounts or whose earnings aren't solid enough to borrow from conventional financial institutions appear to be bridging the gap using digital lending services. The services have made it easier to get a loan. According to a report issued earlier this year, formal financial inclusion or access to financial goods and services has climbed from 27% of Kenya's population in 2006 to 83%. According to Financial Sector Deepening Kenya, the majority of Kenyans utilize digital objectives such as investing in their business and paying salaries as well as to fulfill regular family necessities. Small businesses and businesses in the informal sector may use digital credits to expand and manage their daily cash flow. It can also assist families in dealing with medical situations.
Hata mambo na banka tumesahau kuomba sababu hawezi wakakusikiza, watakuuliza kwamba payslip na payslip wanaangalia uko unapata pesa ngapi ndio akupe pesa yenyewe. Payslip ikiwa chini na pengine wewe hauna mtu wa kukugarantia, hauna mtu wa ofisi ya kusainia, tuliachana nayo.
Kwa sababu kuna wakati nilienda nikawaambia mimi ninafuga kuku, wakaniuliza kama hizo kuku zangu ziko na insurance. Nikawaambia hazina. Wakaniuliza kama hiyo ng'ombe yenye nasema iko na insurance. Nikawaambia haina. So wakaniambia wanaweza tu nipeana ikiwa hiyo mifugo yangu iko insured. Afu mkulima hawezi fikia hiyo kiwango. Ni gumu. Juu habakishi hiyo pesa ya insurance.
Mara mingi wakati vitu zimepanda juu, tunatafutanga jinsi vyenye unaweza tafuta kama vile apps za Blanch, Okash ama Mshwari, mahali unapokopa pesa ili uendeleshe maisha. Kunazo kanuni ambazo ziko kwa benki ambazo lazima you should be a member and you should save amount of money in a duration of time.
Statistics show that the informal sector continues to be undeserving by banks despite the need for financial inclusion to engage the informal sector and sustain the million lives of Kenyans. Individuals who are deemed high risk and low profit demographics have an important role and part to play in the economy of the country. Because most Jokali employees and small-scale traders are not institutionalized, they lack collateral to present financial institutions, and as a result, they are frequently denied loans by banks. These mobile lending institutions have aided bridge building processes by providing credit services to small firms who were previously unable to obtain credit due to lack of a credit score or banking history. Linduta for Uzalendo News.
Each year, technology makes the world more complex for people to understand. However, easy-to-use services like Feliz and Mshwari that help in day-to-day spending are particularly in demand. Joining us live is Alice Mudhoni, a bank manager. Alice, my first question is, according to Bob Hope, a bank is a place that lends you money once you prove that you do not need it. As a bank manager, how true or false is this statement?
Thank you again for having me this morning. In regard to your question, I want to say, to me, I take it as a false statement because financial institutions lend money on purpose, the purpose that the customer has provided, which also must be legit, because as financial institutions, we also are supposed to finance legal businesses. So the purpose must be well defined and in accordance the approved purposes by our regulator, that is the Central Bank of Kenya. So purpose must be clear as day and night. And some of the purposes as financial institution led to could be working capital loans, mortgages, asset finance, medical, education, and purchase of land and such like purposes. The character of the customer must also be very clear and sound. And the financial institutions have a duty to do a background check of the character of the customer and also the repayment ability of the customer. How do the cash flows look like? So that you do not give money to a person who also will not be able to repay back your money.
As a bank manager, what is your stand on the statement that mobile lending platforms are better for the mwananchi than banks?
Yes, I want to agree with you that the digital lending space has taken over the market in a big way. And not to say that people are not going to the banks or the financial institutions to access loans, but you find the bigger percentage is preferring the mobile platform. Why should it be so? And one of the reasons is you find that when you go to borrow money on phone or through the mobile platforms available, there is no collateral that is required. You find most financial institutions also are doing digital lending. So the financial institutions will review your cash flow of the account maybe for 6 months. Then they'll mark a limit on your mobile line. So that's why the digital lending is taking over. And it is also a good way of improving our economy because most people may not be having so much collateral that financial institutions do require, not to mention the paperwork that goes along with processing a loan in a bank. So this one, you just log onto your phone. Within a minute or two, the money is just right with you on your line. So it becomes the easiest way. And so there's no financial institution, I would say, that is seated back and not doing anything on digital space.
Alice, how has advancement in technology changed banking in recent years?
Yeah, digital, as I said earlier, is the way to go. In the recent years, you realize that banking halls are turning to be empty banking halls. Why? Because customers out here have embraced the digital space. The digital space, number one, you find we have the mobile banking platform. Most customers are able to access their accounts through their phones. All you need is to get your account linked to your phone. You're also able to get your account linked to internet banking. So you find customers in their offices, be it companies, be it individuals. You just log in. If your bank has connected you to the internet banking platform, you're able to view your statements, to view your transactions online. And so it's like the bank has moved from the banking hall to your office. We also have ATMs cutting across every corner of this country. And the recent model is the agency banking, where most banks have partnered with their key customers out there to support their customers through agency banking, where a customer can walk there and deposit, can walk there and do a withdrawal. through their accounts without necessarily going to the banks. This is especially when the banks are closed, because banks operate within a time frame, maybe of 8 to 4 p.m., 8 to 5 p.m. So what would happen if after 5 p.m. you still have money you want to deposit, or you want to withdraw your money, maybe more than the ATM limit that you can withdraw? So digital has grown very big in a big way.
Alice, my last question is, what advice would you give those in the informal sector, such as Jokali workers and farmers, who want to access loans from the banks but don't necessarily have collateral or insurance, which, as you had stated, are some of the requirements needed in order to get a loan?
And this is a big sector in our economy as we speak, because most of the money is circulating in the Juakali, in the Sokoni. A lot of trading is happening all over those places. There's a lot of money moving in those spaces. Some may want to do what we call cash cover. They have cash, they want to secure with their cash and access some loans. But we have not ignored as financial institutions this good sector. So there are several ways that financial institutions have come up with in giving loans to these sectors. One of them we call is the most that is very popular is a group lending. You find those border guys, those mama boggers, and most of them, if you walk through the streets, they belong to a chama. And what we do as financial institutions is to educate them that once they register the chama, they come open bank accounts with the banks, and then the banks are also able to start giving them loans through the groups, because the good thing with the group loans is that these loans you co-guarantee one another, so there is no collateral that is required. So you find a group may have 20 members, so you may divide them into groups of 5. So the first 5, those who need, the first 5 they borrow, they are guaranteed by the rest. After a month or two, the next category of 5 they come and borrow, they are guaranteed by the rest, and so on and so forth. So what happens is that these people who are in Juakali are required maybe to do weekly savings. Maybe if you can afford 1,000 bob per week, if you can afford 500 per week, if you can afford 100 shillings per week, you are required to save to a time frame maybe of 8 weeks. And then depending on the financial institution, you find that that is the money that is used as a base for your first loan. It can be multiplied maybe times 5 of your savings, times 4 of your savings, times 3 of your savings, and then you get a loan which you repay within 12 months, or even 6 months, or even 9 months. So that sector is not neglected at all. So we are there as financial institutions to ensure that we are supporting every sector in our economy.
Thank you so much for joining us, Alice. It's been a pleasure.
Thank you for having me.
According to a new research from the Centers for Disease Control and Prevention's National Center for Health Statistics, just about a quarter of Americans meet all national physical activity requirements. Adults should obtain at least 150 minutes of moderate or 75 minutes of strenuous exercise each week, as well as muscle strengthening exercises at least twice a week, according to federal physical activity standards. David Mully with more details.
According to new study from the Centers for Disease Control and Prevention's National Center for Health Statistics, just 23% of American adults fulfill leisure time activity requirements. The United States Department of Health and Human Services advises that people aged 18 to 64 engage in at least 150 minutes of moderate or 75 minutes of strenuous physical activity every week. According to new data released, just 22% of individuals presently satisfy these standards. This does, however, imply that the department's Healthy People 2020 initiative, which began in 2010, is on track to fulfill its target.
I come to the gym on a daily basis. During the time of COVID, we were a bit affected because the gyms were closed, but I took it upon myself to start running. So I was running on the streets, doing about 5 kilometers daily. You don't have to have a gym. Even without a gym, you can still work out, because working out even in the house, you can do your exercises in your own house, You don't have to go to have a gym, even our gym instructor. You take it upon yourself if you think that you want to lose, but even exercising is not about losing weight, most is about keeping fit. So when you're not losing weight, you can still do exercises to keep fit.
You couldn't access the gym, but you had to work out from home because you needed to stay fit. You need a gym, that's for sure. But if you can't access the gym, if you can't access the gym, you must work out from home. You need to work out from home. You just need to know the workouts, what to do. Yes, of course, you have to follow the diet. But I've just figured out in Uganda, most people who work out don't follow diets unless they know what they're doing. Like me, because I follow diet. I don't eat a lot of fats. I eat a lot of fats. I happen to take a lot of protein with me. I do veggies.
Exercise not only changes your body, it changes your mind, your attitude, and your mood. John F. Kennedy once said physical fitness is not only one of the most important keys to a healthy body, it is the basis of a dynamic and creative intellectual activity. David Muli for Uzalendo News.
The late Nelson Mandela once said, "Exercise is the key not only to physical health, but to peace of mind." Working out gives us an outlet for suppressed energies created by stress and thus stones the spirit, just as exercise conditions the body. Joining us live is Sylvester. My first question, Sylvester, is many companies advertise with the tagline, "Lose 10 kgs in 2 days." How can someone verify whether this is true or is just another marketing strategy?
First, don't believe on the adverts. First, verify the source. If it's from a company, verify the registration details for the company. Whether it's approved by Farmers and Boston's board, or it's a medical device, whether it's approved by medical practitioners and its union. Then from there, the second thing, you go to the product itself. If it's a tablet, you just confirm on the package. After confirming the package, confirm the registration details. That's when you will know whether what the label is claiming is actually what is active in creating that product.
So, Sylvester, how effective are weight loss pills such as ketone capsules and Garcinia cambogia in terms of not only losing weight but also living a healthy lifestyle?
First important is to if you want, for example, you want to lose weight, the first step is a lifestyle change. You eat healthy. So those medication tries to assist you to lose the weight faster.
And lastly, Sylvester, what is your opinion of companies that manufacture slimming pills with the promise of helping people lose weight in a short period of time?
The first step, what they are doing is something illegal. And when you are doing something illegal, you are supposed to be prosecuted. You just produce, if it's a company, you just produce that information, you know, Farmers and Boston's board or the regulatory authorities, they are not everywhere. If you see something like that, you validate that information. Yes. That's the best way to tackle that.
Thank you so much for joining us, Sylvester.
Good morning.
Dad, vitamin B2 ni nini?
Vitamin B2 zinapatikana kwa Ilara Fresh Milk. Na unahitaji hizo vitamins kila siku kupata energy, yani mawowo.
Mawowo. Mawowo ya kucheza, mawowo ya kuruka, mawowo ya kuswing, mawowo ya kudunk.
Mawowo. Ilara Fresh Milk, jijaze mawowo.
That is it from Uzalendo Newsroom. I am Lisa Mudhani. Thank you for joining us and watching till the end. This is Uzalendo News.